In this module, we're going to talk about comparing outcomes when we have more than two groups. We're still not looking at randomized controlled trials. This is still in the context of clinical practice, where maybe you have 3 groups of clients, 4 groups of clients, whatever it is. You've got separate groups of clients that were not randomly assigned as part of an experiment, but were assigned based on maybe the clinic they were treated at or the year in which they were treated, but it's not a random process. It's part of clinical service delivery. The flowchart is basically the same as when we had 2 groups, except that we're not going to be using confidence intervals. This is all about hypothesis testing. So the situation, you've treated some clients, your intervention group, the group that you care about, and you're going to compare that group's outcomes to some other groups that you've also taken the same measure from, and they're your comparison groups. And you have more than one comparison group. So you're going to make multiple comparisons. You've got the intervention group and your first comparison group, and the intervention and group and your second comparison group. This is another case where there's a distinction between what a statistician or a scientist would do and what a practice scholar does. A statistician, a scientist, a researcher, they're going to analyze their data using an ANOVA or an ANCOVA. What we're going to do as practice scholars is make multiple pairwise comparisons. So if you only have post-intervention data, right, so your data would look like this outcome table, where you've got the intervention group and multiple comparison groups, and to make all of these comparisons, they would do an ANOVA or an ANCOVA and find out if there's some statistically significant difference within these groups. They're essentially doing all pairwise comparisons. What a practice scholar does is skip straight to the post hoc comparisons, basically looking at doing something like a t-test or a Mann-Whitney, whatever it is, doing those comparisons between the intervention and comparison group 1, intervention group and comparison group 2, and then correcting for those multiple comparisons. If you have both pre and post intervention data, so the statistician again would use an ANOVA or an ANCOVA to make these comparisons. What we as practice scholars are going to do is do the same pairwise comparisons with the change scores, just like we did when we only had 2 groups. The only difference is that we're going to correct for multiple comparisons. Now, we've discussed Bonferroni correction in evidence-based practice. All we're going to do is reduce our alpha, our cutoff for statistical significance, based on the number of comparisons. So normally when we only have one comparison that we're making, we're looking for P to be less than 0.05. That 0.05 is our alpha value. For the Bonferroni correction, we're going to divide that 0.05 by the number of comparisons. So our alpha, if we have 2 comparisons, becomes 0.025. Now, there are ways to adjust confidence intervals for multiple comparisons, but it's complicated. It's not a straightforward process. It's not something that is easily done in SPSS or in an online tool. So we're going to focus instead on the hypothesis testing exclusively.